Good afternoon, everybody. My name is Dr. Stephen Loos, and I'm the Director of Outpatient Mental Health Services at Central Minnesota Mental Health Center. And October is Domestic Violence Awareness Month. We thought it would be great if we could have Central Minnesota Mental Health Center, Rivers of Hope, and Hannah-Ruth Alliance put together this video to raise awareness for domestic violence. So that's what we're going to be doing here today. One thing I want to name is that I am coming at this from the perspective of a white male with considerable privilege. And so certainly I do not know all the aspects of the impacts of domestic violence, but as a trauma therapist, I know it's important. And with the position of privilege that I do have, I also want to raise my voice up to call for an end of domestic and family violence. All right, now I'd like to bring to the conversation Rivers of Hope, great partners of ours in the community of Monticello. So I'll introduce Hannah-Ruth, the Executive Director of Rivers of Hope.
As you said, I am Hannah-Ruth. I'm with Rivers of Hope as Executive Director.
And I am Mel, and I am part of our youth team.
We are a domestic violence center serving Wright and Sherburne counties. We do this through adults and youth advocacy. Our mission is to provide a community-coordinated response to end family violence through advocacy, education, and interagency collaboration. So we really prioritize our partnerships and the relationships we have in our community with schools, law enforcement, the counties. In 2020 through now, we were able to serve 415 adults and 154 youth. That says a lot about the work our advocates are doing, that they were able to maintain that size of caseload even through the pandemic that we've experienced.
We provide a number of services to both adult and youth. On the adult side, we provide resources and assist with those resources. We sometimes need to create safety plans. We help with finding shelter so that our clients are safe. Sometimes we help with obtaining court orders. In our youth program, we focus on providing crisis intervention, providing individual support for our students, and touch on the education and pieces of empowerment for our young people. It is important to us to come together in the communities that we serve. We work in partnership with schools, with law enforcement, social service agencies, and court systems, aiming for that goal to end the cycle of violence. There are some basic warning signs to unhealthy relationships that I want to touch on that can impact youth and adults. If your relationship is feeling drained, like it takes a lot of your energy, if there's a lack of trust, sometimes control can be a part of the relationship, even over food, money, and sometimes the clothing that you wear. There sometimes is a sense of fear or pressure and intimidation in the relationship. Sometimes people have to put up with put-downs and name-calling. In these basic warning signs, it's important to recognize them early so that individuals can get the help and support that they need. I'm happy now to introduce Charles, who is part of Anne-Marie's. Charles?
Thank you, Mel. My name is Charles Hempeck, and I'm the Executive Director with Hannah-Ruth Alliance. And our mission is to provide a safe place for victims of domestic abuse and to achieve systems change that will reduce violence. So we provide that really basic food, clothing, shelter, as well as supporting their emotional needs, mental health, providing childcare, helping support them when they're looking for work or if they need help with either chemical dependency or mental health referrals. So to really provide that. And Anna-Marie's also is out in the community doing work within the school system, out responding to on-scene advocacy work when domestic violence happens and law enforcement responds, or following court cases, doing safety planning with women and children and families. And so really trying to provide the breadth of support that is needed for survivors of domestic abuse. And so often people wonder what they can do if they suspect a friend or a loved one is being impacted by domestic violence or intimate partner violence. And so it continues to impact tens of thousands of people here in the state of Minnesota. Anna-Marie's Alliance alone serves nearly 2,000 people with our shelter as well as out in the community on an annual basis. And also Violence Free Minnesota estimates that in 2020, there were 30 known victims of intimate partner homicide. So it really impacts a lot of different people. There may be times when you are concerned about a friend or a loved one and if they might be in a relationship that's abusive. And so I think there might be some warning signs people can look for that can help you identify if you think your loved one or friend is in an abusive relationship. And some of those things, the person might become more withdrawn, and you might see their partner exhibit jealousy, maybe some possessiveness. Your friend or loved one may talk about cruelty to animals or verbal abuse, very controlling behavior. So any of those things that you're might be hearing about might be signs that they're in an abusive relationship. And so I think it's really important to reach out to that person, really ask them how they're doing, if they're feeling safe in their own home, and then talk about what some options they might have. So reaching out to Rivers of Hope, Anna-Marie's Alliance, or any other sort of local domestic violence agency in your area. And so it's just always important to make that effort to ask the question. Even if you're wrong, it's better to err on the side of safety than it is to not ask the question and find out later that you could have maybe intervened at some point in time. So I'd like to pass it back over to Stephen now for him to continue.
Thanks so much, Charles and Mel and Hannah-Ruth. You just have wonderful organizations, and we're so happy to partner with you. At Central Minnesota Mental Health Center, we're then there to continue to walk along that path of recovery for the survivors. And it's helpful to know, I think, that all of our staff have been trained in trauma-informed care. And that's to create a warm, welcoming environment for people when they're ready to receive services. So that means our board of directors, our support staff, our IT, our maintenance, all of us come from that framework of trauma and creating that safe space for recovery. So we'll really work with you to explore not what's wrong with you, but to take that lens of what happened to you, to explore healthier relationships and explore recovery through all of our services here at Central Minnesota Mental Health Center. We prioritize trauma, and if we know about personal or community tragedy, we'll get you in for appointments really quickly to start that process. We also have crisis services, so we know that following an instance of domestic violence that you can't wait for that next appointment. And so that's where our mobile crisis team and our 24-hour crisis hotline can support you day or night. Thank you so much for joining us today. We know that there are countless people out there right now that are being subjected to domestic violence and are in need of help. So we hope this video reaches you and that we show that Rivers of Hope, Anna-Marie's Alliance, and Central Minnesota Mental Health Center, we are here for you. We collaborate, we work together, and we want to provide a place of healing for you.